everyone. I'll start by talking about this devastating disease. We all know that glioblastoma or malignant gliomas has very poor survival. The 5-year survival rate is below 5%, and nearly 100% of the patients recur eventually. Comparing to other cancers, the brain cancer has very limited options. For systemic treatments, there are only 2 drugs that were approved by the FDA. There are temozolomide and bevacizumab. And temozolomide is a small molecule that can cross BBB already, but bevacizumab itself is a large molecule that cannot cross the BBB. So, other than this kind of systemic treatments, we have limited options to treat brain cancers. So, focused ultrasound might offer a game-changing alternative to echo the clinical challenges. And this timeline is just to show the teamwork established and led by Dr. Ko Ting Chen and Dr. Liu since 2008. So many of these preclinical studies have made the foundation to our clinical advancement in treating malignant gliomas. However, nothing will happen if we do not have a device to treat humans. So since 2014, Dr. Liu invented a dual frequency ultrasound-based array system, and then start the tFUS company since 2015. So many things becomes possible for our devastating patients. So we completed the first safety trial using tFUS 001, and we found that we can precisely and transient and with a dose-dependent manner to open BBB non-invasively in recurrent GBM patients. Turns back to the bevacizumab, which is already FDA-approved medication to treat malignant glioma. However, from the literature review, we found that the 6 months progression-free survival was still very poor. Less than 50% of the patients would have a disease-free, progression-free, less than 6 months. So there's a large gap to fill in this field. So our team found that with the help of focused ultrasound, we can successfully deliver more bevacizumab into the tumor with 5 to 50-fold. And then the animal survival will increase by 135% from preclinical studies. However, there are still paradoxical effects of bevacizumab being raised. 2 arguments on bevacizumab in malignant glioma have been raised. The first one is its anti-VEGF effect, which has been thought to be the main mechanism to lead to the contrast enhancement reduced that has been called as a pseudo response in the field of recurrent GBM patients. And the second one is the vascular normalization effect would decrease its own penetration into the tumor. Luckily, and we have some evidence to support our hypothesis that there is one study showed that both glioma cell regression and vascular normalization was seen in high-dose bevacizumab preclinically. And there are clinical trials, just to mention one, to try to use selective intraarterial delivery of bevacizumab after the hyperosmolar agent BBB opening to treat both newly diagnosed and recurrent GBM patients, and have had safety and prolonged progression-free survival results. So with that in mind, higher dose and local regional delivery, so that might be where we focused ultrasound can use. So we deliver a a study using focused ultrasound combined with bevacizumab since 2020. And the basic scenario is to adopt ultrasound with bevacizumab as its biweekly schedule in the recurrent GBM patients. Our endpoint was progression-free survival at 6 months. Of course, we need a precise energy control, and with this real-time feedback called acoustic emission feedback and acoustic emission mapping system, we can control the energy and provide safety to the patients. So with this help, we can also gather more data real-time from the intracranial and backscatter acoustic emission, and that will be helpful for future analysis. In terms of the workflow, before actually doing the treatment, we can do a RI selection and fast simulation with a software. And in the future, there will be a back and forth because the tumor will be followed at least for 6 months or 9 months, and several MRIs will be checked. So if anything changes, you can actually change the treatment plan. Of course, this was not done by any clinical trial. However, in the future, if it is clinically adopted, the back and forth simulation would be very convenient for brain tumor treatment. So for the outcome, I would just like to emphasize this. In our 6 patients, we have a mean of 6 targets in each patient and a median of 14.5 treatment sessions for these patients. And there was less than 2% of the patient had FUS-related adverse effect, which was transient scalp heating. Comparing to the neuromodulation effect, I think it's lower because our treatment duration is shorter. So we achieve a safe and feasible repeating FUS-PET treatment in recurrent GBM patients. Then we overlay the different treatment trajectories into the MRI and to collect this region being exposed by the focused ultrasound energy. And to see the analysis of the T2 flare hyperintensity regions, which has been concerned to be biomarkers for tumor infiltration in gliomas. We found that comparing to non-exposed region, the blue one, the focused ultrasound exposed region has a reduced flare hypersignal intensity, which means that the flare normalization effect actually started since 1 month after treatment. Also, we try to use the serum biomarker, cell-free DNA, and you can see after focused ultrasound treatment, the tumor-specific and housekeeping gene was elevated after FUS treatment. And if we try to analyze the elevation CFDNA ratio with all of the parameters we have able to detect, like the T2 coverage by the focused ultrasound, or the acoustic pressure, the acoustic emission feedback peak and AUC, or acoustic emission mapping. We found that with the combination of AEF, AUC, and AEM, we can achieve significant and medium correlations between the elevation of cell-free DNA and these biomarkers. So in conclusion, the FUS BBBO is feasible to combine with bevacizumab repeatedly for treating recurrent GBM patients. A significant normalization effect of flare hyperintensity has been observed in FUS-exposed versus non-exposed peritumoral regions. FUS BBBO enhanced liquid biopsy or sonal biopsy has been confirmed, and the concentration of cfDNA was better correlated with real-time acoustic emission feedback data. Therefore, a phase 3 randomized trial is needed to prove the therapeutic efficacy of FAST-PET combination in recurrent GBM patients. So we are about to kick off the phase 3 trial. Our recruitment will be start next month, and we are looking forward to this data and hopefully become able to share with you in the near future. And I would like to thank our team, Dr. Liu and Dr. Wei, and all the team members for this support. Thank you.